Hi everyone, welcome back to another edition in the Nico the Vet channel. Well, today I thought what we might do is show you a video of how a cat is desexed. The surgery will be performed by a colleague of mine called Carolyn. So I think we're good to go. So desexing, what are we doing? Desexing animals, cats or dogs, goes by different names across the world. Some people talk about desexing, some people talk about neutering, some people talk about sterilizing, and some people talk about spaying. Even with spaying, some people spell it S-P-A-Y, some S-P-E-Y. In effect, what we're trying to achieve is to remove, at the very least, to remove the ovaries from the cat or the dog, and generally also the uterus. Why? Why would we do the surgery? It's two reasons. One is if we take away the ovaries and the uterus, she can't have babies anymore, so it is a very effective birth control. And secondly, it stops her coming into season, because girl cats are on a 3-weekly reproductive cycle. So 1 week in 3 they'll be effectively in heat, calling out for boys, and for them that's very frustrating for them if they can't fulfill that ambition. So in terms of the surgery, Carolyn has just made an incision through the skin, just behind the belly button, just to show you. Her head is over here. She's got a tube in her throat, giving her oxygen, and a monitoring device on her tongue. So obviously her tail end is that way with the surgical equipment. So we make an initial skin incision, go through the skin. Beneath the skin is the fat. We go through the fat, then through the muscle layer. If you're fortunate enough to have a 6-pack abdomen yourself, the line going down from your belly button down to the pubic bone, that line in the 6-pack is the linea alba, which is just a Latin word for white line, and that's the incision that Carolyn has made. And then effectively you need to fish out the uterus. So if you look at the female reproductive tract, if you start at the back end, you start with the vagina, which leads to the cervix, which leads to the uterus going forwards. And the uterus starts with what we call the body of the uterus, which is attached to the cervix, and then it splits into 2 horns, so 2 tubes going forwards, one on the left, one on the right. And right at the very end of that is the ovary, which is the structure that you can see just there. And attached to that is the thin tube called the uterus. So the ovary has its own blood supply coming from, think of it as just behind the last rib, and that's what Carolyn is tying off now. Because obviously if we take the ovary out, the blood vessels that were supplying it need to be tied off, otherwise they will bleed and she'll lose blood. And then going backwards, we can see the uterus, the horn of the uterus. So Carolyn is just transecting that now. So there's the ovary with the fallopian tube, which is the little tube you see just to the right of it, and then the long tube going into the abdomen. So that's the left, it is the left, isn't it, Carolyn? See, the left horn and the left ovary removed. And Carolyn's just following it back to the body of the uterus, which is there. That is the bit that connects to the cervix. And she'll just do the same on the other side. It's just to find the ovary, identify it, tie it off. Clamping it first, of course, tie it off. Now the suture material that she's using will tie off the artery. That stays obviously inside of the patient, but it dissolves over time. This particular suture material will take about 9 months to dissolve, in which time the blood vessel that was supplying the ovary will have sealed off, and so when the suture dissolves, there'll be no risk of bleeding into the future. So that's the right side down. The right side can sometimes be a little bit more awkward than the left side because it is a little bit further forwards, but you wouldn't know it just to see how easily Carolyn's doing the surgery. So there it is. Again, there's the front of the little cat under the anaesthetic monitoring, which is all this equipment over there. And so Carolyn is stretching back the 2 horns of the uterus, which is where dogs and cats have their pregnancy. So when they get pregnant, the babies are in those long horns. In human beings, our uterus is mostly the body, which is where she's put the clamp now, and the horns are very short. So as human beings, our pregnancies happen in the body of the uterus, whereas dogs and cats have them in the horns of the uterus, those long tubes you see, which is why they can so easily have so very many babies. So this is the body of the uterus attaching to the cervix that Carolyn is tying off now for the same reasons. There are 2 big arteries on either side, the left and right uterine artery, which feed blood supply from the cervix forwards into the uterus. That's the main blood supply to the uterus. The ones she tied off earlier are the ones to the ovaries, and she'll clamp that off now. That's the bit that's going in the bin. And so obviously now she's got, the ovaries are gone. So it's not like in human beings where you just have your tubes tied so the eggs can't move into the uterus, but you've still got your ovaries. In this instance, we don't want the ovaries. So again, for two reasons: we don't want her to have babies, but also we don't want her to have the hormonal cycle, which will be very, very frustrating for her. Anyone would have heard that when queens are meowing and yowling, looking for a mate, and they're not allowed to do so. So it does make her life a lot simpler. So this is in reverse order now. Carolyn's initial incision was through the skin, through the fat, and through the muscle. This is now closing the muscle layer, again with a dissolvable suture. Different vets make different size incisions. Carolyn's been doing this a long time, so this is an absolutely tiny incision. People will sometimes ask about keyhole surgery for this procedure, and yes, it is an option for this surgery, but I think when you have a very experienced surgeon who can do the whole procedure this quickly through this small of an incision, it really is in effect keyhole surgery. Because remember, to do it laparoscopically is what people mean when they say keyhole. You'd have to make 3 holes almost this size, because 2 are for the ports that go in to put the instruments in, and 1 is for a light source to see on the inside. So yes, laparoscopic surgery, there's an argument for it. But again, I think in the hands of a good surgeon like this, this is probably the better option. It's certainly a lot faster, and I would argue it's probably even less traumatic than having 3 access ports going in. So 3 sutures later, and the muscle layer is closed. Falling along. So when you close the abdominal wall, which is again is that line down the middle of your abdomen if you're fortunate enough to have a 6-pack, the only thing that's holding this little girl together now for the next few days will be these sutures. So we don't want her running and jumping and exerting too much, because hypothetically she could snap the stitches on the inside, and again it's not really enough time for the muscle layer to close, so she could end up with a big hernia where the intestines move through that hole. So we only really need to keep her quiet for about 5 to 7 days, by which time it will have healed and be strong enough. The second layer closure is the fat layer that Carolyn is closing now. That's a very important layer to close. If we don't close it, it leaves a space of just nothingness, where there's nothing, and the body doesn't like nothingness, if that's a word, and we fill that up with serum, which is a big sort of swelling of fluid, which is not an infection, just a swelling of fluid. And usually we can avoid that happening by placing this suture, which just closes that space. And then the last stage is just to put some stitches in the skin. So going back to saying we need to keep her quiet for the next few days, it's extraordinary how well these girls recover from this surgery. Although this looks like a very quick, simple procedure, it's not. You have to remember that she's going through a full hysterectomy. And if you speak to any human being who's had a full hysterectomy, they'll tell you it's not a fun day out, and it often takes us as human beings at least a couple of weeks to recover from it. So just keep reminding yourself, it's not just a spay, it's not just a desexing, it's a very, very big deal for the individual involved, and we need to treat them with kid gloves. Again, the biggest problem is cats being cats will recover so quickly, particularly with surgery done as efficiently as this, recover so quickly that they'll almost feel too good too soon and try and do too much too soon, which can give them a bit of a setback if they pull and hurt themselves with the sutures. It shouldn't happen, it's very rare, but it could, and so we do need to keep them quiet. So last stitch going in now is just going in the skin, closes the wound, and there it is. If we move the drape away, I'll just show you to be done. Yeah, just take the drape away, and we can see there's the beautiful little kitten on her back to sleep. There's the vein, the syringe and vein that gave her the anesthesia to knock her out. She's perfectly comfortable and very well monitored by an array of instruments there. That's the machine with the beeping, and these are the anesthetic circuits. So thank you very much for tuning in. I know some people may find it a little bit gory, but I think it is reassuring for people to see that although it's a very, very big surgery, it's a very routine surgery for most vets, and very, very well tolerated. So thank you for signing in, and I'll see you all at the next episode. Thank you. Bye-bye.